So the sister is worried about this patient, so let's try and break it down. The first question you would want to ask yourself is this a physiological or pathological jaundice, and when do we act? Before we answer that question, it's important for us to remind ourselves of the kind of a patient that we are currently having. After seeing this patient, you could be asking yourself, which one of the following differentials is the most likely in this preterm baby? Physiological jaundice of prematurity, of course. 1, this is a preterm baby. Secondly, this jaundice started after 24 hours. 2, 3, this is a stable baby with no known red flags. Preterm babies tend to have more jaundice than term babies because of, 1, of the immaturity of the liver enzymes, especially the UDP glucuronidase, which will then reduce the bilirubin conjugation. Secondly, these patients have increased red cell breakdown, mainly because premature babies have higher levels of red blood cells as compared to term babies, and they also have decreased half-life of these red blood cells, which ranges from 70 to 90 days as compared to 121 days in term babies. They also have decreased gastric motility, which will then cause stasis of bile in the intestines, and this will then facilitate enterohepatic circulation. The fourth one is the fact that preterm babies have feeding difficulties, and therefore this will lead to, if they're not getting enough breast milk, this will then lead to less bilirubin being eliminated in the stool, and therefore stasis of bilirubin again in the intestines, which will also then facilitate enterohepatic circulation. The other thing that we need to remember about these patients is that they have an increased risk of kernicterus at lower levels of bilirubin as compared to term babies because of immaturity of their blood-brain barrier. So it means in preterm babies, you need to have a higher threshold of starting them on phototherapy early because of the increased risk of kernicterus because of the immaturity of the blood-brain barrier. When should we start phototherapy in this particular patient? We use the gestational age of the patient or gestation-specific nomograms for us to decide when to start phototherapy in preterm babies, because the gestational age tells us about the maturity of the blood-brain barrier. As we have said, that these patients have an increased risk of kernicterus at lower levels of jaundice as compared to term babies because of the immaturity of the blood-brain barrier.